Today, I want to talk about a case that we saw in our clinic. This is a case of a 28-year-old female who was involved in a very bad car accident around 2 years ago. Ever since then, she has been experiencing a lot of tension. Started with a little bit of tension, then progressed into more strong spasms. And from there, she also started experiencing more headaches, more intense headaches, more frequent headaches, and then in turn into numbness and tingling sensations that would go into her shoulders, into her arms. And basically, after a year or so, it was going all the way down the arm into her first 3 fingers. Again, 28 years old, very young, should not be having to go through any of this. At the time, she went to different doctors. They prescribed things like muscle relaxers, anti-inflammatory medication. They escalated a little bit there, but nothing was really working long term. And she just kept getting worse and worse, to the point where she was not really able to have pain-free workouts and things like that. We did a physical exam, very thorough physical exam. Her sensations were diminished on both sides. Reflexes were also diminished based on the symptoms where she was feeling it in the shoulders, arms, and kind of like those first 3 fingers. I knew that she was going to have some sort of findings, most likely in the lower portion of the neck. We gave her a prescription for an MRI of the neck, and that's what I kind of want to share with you. So basically here we have on the right side something that resembles more of a normal MRI of the neck. So you have this nice curvature. This is the front of the neck. This is the back of the neck. Here, this gray thick line is going to be your spinal cord. And then this little square shape figures are your vertebra. And in between, you have the disc. Now, on the left side, we have this patient, and you can see that her neck is pretty much straight. Spinal cord is just going straight down. And if you look at the curvature of the vertebra, look here how they kind of go in a curvature this way, kind of like a C, versus here, you can almost argue it's reversed. This is what's called a military neck or straight neck. There's almost like a reversal of the curvature of the cervical spine. That's one thing, right? So this is going to require some rectification of the curvature of the cervical spine. On top of that, let's follow along this line here. And when we follow that white line, you see that there's almost like the same consistency, the same thickness all around, right? From the top all the way to the bottom. But here it starts kind of thick, right? And then starts getting very thin. And you start kind of getting this like bumps here. What's happening is her discs are bulging out. They're starting to bulge out. You can see that the 2 that are the worst, they're bulging out, and then they're putting pressure into the canal, into the spinal cord. And depending also in which directions they start bulging out, they'll put pressure into the nerve roots. Everything in the neck is going mostly into your shoulders, down the arms, and into your hands. That's how kind of like we can tell that depending on the symptoms that the person is feeling, there's most likely something going on there. This was a case of rectification of the cervical spine, trying to get her to have a better posture than just this kind of like straight line or reverse curve. On top of that, we were focused a lot on very precise technique from a chiropractic point of view and a lot of decompression. We're trying to create as much space to release that pressure off of the nerves so she doesn't feel some of the symptoms that she's feeling. Signs and symptoms of nerve compression typically will be things like numbness, tingling sensations, pins and needles. You might feel like if somebody touches me on this arm, like I barely feel it, versus like this arm is okay. Now in her case, both upper extremities of both arms were affected. She spent about 2 years like this. I know she tried different things. She did a little bit of PT. It wasn't successful. But for the most part, I know she was doing more of like pain management approach. At the beginning, they were doing more of muscle relaxers and anti-inflammatory medication. Didn't give her long-term relief. She came to us. We worked on her for about 3 months, like a month and a half to almost 2 months. She was almost pain-free. We sent her home as well with a cervical pillow to try to get as much extension, which is when you are basically looking up, as we can on that cervical spine. Try to get that normal curvature. We gave her a lot of different recommendations, and she was able to go back to the gym. We definitely guide her with that on what to do, what not to do, at least for the beginning of the treatment. Something else to point out with this case is towards the end of the 2nd year, she was feeling desperate to the point where she kind of started cracking her own neck, is what she would say. She would crack her own neck in the morning. And then she would tell us that, after a few hours or so, sometime in the afternoon, she would feel that urge of like cracking it again. This is something that I get a lot here. I want to share with you guys kind of like what I share with my patients here at the clinic. The medical term for the cracking sound is it's a cavitation. And anyone can cavitate a joint in a lot of different ways or a lot of different directions. When you're doing it, for the most part, you're just doing a random movement. It can actually create more problems, first of all. But second of all, you're doing something completely random. You're not looking to apply a corrective force. You're not looking to go in the right direction. We're just trying to make it pop, kind of thing. What ends up happening too is that you're not going most likely in the right direction. You're not applying a corrective force. And on top of that, you're just moving, for the most part, segments that are already movable. You're not really addressing the one that it's restricted or the one that's causing the issues. And so what ends up happening is you feel that urge again, maybe 6 hours after that first crack. You feel like, hey, I need to do it again. Like there's just something in there that doesn't want to release. That's usually the sensation that most patients have. So definitely in her case, this was something where I was telling her from day one, you're gonna stop cracking your neck. But I also have good news for you. You're gonna feel like you're not gonna have to. We're actually, with the techniques, the consistency and the repetition, we're going to start putting in new patterns, and you're gonna feel better. And your body, once it sort of recalibrates, it's not going to feel the need to tell you, hey, we need to do something about this. What ended up happening was, at the beginning, we would adjust her with a little bit more frequency at the beginning of the treatment. Obviously, as she was getting better, we were dialing the frequency down, and she could go a week, then 2 weeks, 3 weeks, up until she was able to go a month and over a month without feeling that sensation ever. This was also a case where we always combine the adjustments. We want to be very precise with the technique, and then we combine that with rehab modalities as well as rehab exercises. Happy to share that she made a full recovery, 100%. We sort of gave her some lifestyle recommendations. Once you start having bulging disc or hernias, the tissue around it is sort of distended. You can reverse a lot of the symptoms, and the position of the structures can definitely improve, but you have to always be aware that a change from what was there originally has taken place, and you just need to be more conscious about how you do certain things, which in her case, it was mostly what we call postural hygiene, basically making sure how you're positioning yourself throughout the day, trying not to maybe look down so much, the way you're sleeping, the way you're performing certain exercises at the gym. If you know of anyone that maybe they're going through a PT program, maybe they're not getting the results that they're expecting, maybe they're going through some sort of pain management program as well, and it's not working, it's not giving them long-term relief. And again, I'm not against pain medication or anything like that. I think it has a place and a time. Muscle relaxers, anti-inflammatory medication, it works at times, but sometimes you need more than that. And sometimes when it's more structural problem to the core, we definitely need to do something more for the surrounded structures, so tendons, the ligaments, the fascia, muscles, that sort of thing. Sometimes the pain medication can just feel almost like a general anesthesia that you're trying to apply, but it's not fully correcting the root cause of the issue. So if this is you, if your images look like this, maybe you've been to a doctor, they send you out for an MRI, this is what they're looking, or if you know of anyone that might be feeling any sort of like numbness, tingling sensations, we are definitely happy to help. It's not always the case. There's a lot of different things that can cause compression of a nerve, right? Bulging disc is a very common one, but it's not the only one, right? You can have very serious conditions that can be causing this, so it's always advised that you go and get checked by a licensed professional. So if you know of anyone that is having images like this, or maybe yourself, a friend or a family member, or they're having some of those signs and symptoms that I just described in this video, feel free to give us a call. We're located on the north side of town in the city of Naperville. Our adjustments are very objective oriented, very precise. We use images for most of them, and definitely combine chiropractic with a lot of different rehab modalities and rehabilitation exercises to basically give you the best results.